nervous system is anatomically organized into central and peripheral nervous system. Now, what do we mean by central nervous system? As you can see in the image, the components of the central nervous system are brain, spinal cord, which we all know. But the other two components that we often forget are the optic nerve and the retina. Even these are considered as part of the central nervous system. But apart from this, when we talk about peripheral nervous system, the peripheral nervous system includes the following components. One is the spinal nerves, then we have the cranial nerves. What are cranial nerves and spinal nerves? These are collectively grouped as peripheral nerves. What exactly are peripheral nerves? If these nerves arise from the brain, they are called as cranial nerves. If these nerves arise from the spinal cord, they are called as spinal nerves. We will learn about details of this cranial nerves and spinal nerves. Then, apart from this, we have ganglia. We will see what exactly is a ganglia and what are the different types we have. In the end, the special senses. The special senses like vision, hearing, taste, all these come under peripheral nervous system. So, this is the anatomical organization of the human nervous system. When we talk about the functional organization, right? The functional organization of the nervous system is quite different. What is the functional organization? When we talk about functional organization, the functional organization of the nervous system is into an afferent division and an efferent division. The afferent division is synonymous with the sensory division, whereas the efferent division is synonymous with the motor division. Further, each afferent and deferent nervous system are further grouped as somatic and visceral. Now, what is the literal meaning of somatic and visceral? The literal meaning of somatic is body wall, right? So, when we have the term somatic with respect to nervous system, these nerves which belong to somatic nervous system innervate mainly the structures of the body wall, including skeletal muscles. Whenever we use the term visceral includes three structures, and these three structures are the cardiac muscle, smooth muscle and exocrine glands. So, whenever we use the term somatic, it is more or less often skeletal muscles and other structures forming the body wall. Whenever we use the term visceral, it applies to cardiac muscle, smooth muscle and exocrine glands. Now, why is this important? Remember, the visceral efferent component of the nervous system is what we call as autonomic nervous system. This you must remember, okay? Basically, autonomic nervous system is an efferent component of the nervous system which supplies only viscera or only three structures, right? This is the first basic understanding that we need to have regarding the functional subdivision of the nervous system and what exactly is the definition of autonomic nervous system.